You're on mute, Helen.
That's a pound in the mute pot before I've started. That's not off to a great start, is it? So, thank you for having me here today to talk through the Healthwatch Derbyshire GP Access report. So, I'm going to just start with some introduction to what we did, how we did it, and why we did it, and then hand over to my colleague Claire, who will bring you up to date with what we're seeing and hearing today and the kind of feedback that we sort of continue to collect from people and patients in Derbyshire. So the background bit sort of first of all. So back in the summer of 2022, we did our GP access report. I don't know if anybody's got the slides that they're able to put up for me just to help through the presentation. We collected 1,300 responses to a survey essentially that went out to patients, to carers, and to the wider community. So we got really good response rate. And initially we did that sort of as a result, if you like, of the COVID pandemic, just to try and get a feel for how people were using services and what changes had occurred during the kind of COVID experience and how all of that felt to people as we emerged from COVID, if you like, in terms of how they access their GP. So that was kind of the backdrop for it, essentially, at the time, because we were very aware that people were using their services in a different way on the back of COVID. So it gave us a really good snapshot at that point in time. We were also aware, though, that not obviously everyone is online. So we shared the survey with every GP surgery and encouraged them to get their practice population to fill it in. And we worked with over 200 organisations as well across the county to try and encourage as many different types of people to share their views and feedback as possible. And we did an easy read survey, and Claire, as an engagement officer, was part of the team that kind of led on that work to try and get as many representative responses as we could. And we were really pleased with the number of people that spoke to us. So then in terms of sort of what we found, we've got just a little bit of data there around sort of what people told us about them having telephone appointments, face-to-face appointments. And the other thing that was really interesting there was around eConsult. And, most people that had used eConsult did tell us that they were either really pleased or very pleased with how that looked and felt. So that certainly seemed to be something that we picked out in our recommendations, was that bit of opportunity around eConsult. So the main themes that came out from people that spoke to us were around compassion, and that being shown during appointments and how valuable that was when it occurred. That the telephone appointments were often appropriate, convenient, and met people's needs. And a lot of stuff about people being responsive, and I suppose explaining expectations, and this fits in with the next point really around communication, and something we hear regularly at Healthwatch is people don't mind if, as they understand what's happening and why, then it makes an awful lot of difference to how people feel about an experience. If that communication is there so that people get what's happening and they understand why, it really changes the dynamic in terms of that kind of consultation. And people told us that generally that they were happy that those wait times were acceptable for them. But communication, information, and understanding was certainly far and away the clearest theme that came out from what worked really well when that was in place for people in Derbyshire. So we poured all of that into some recommendations. I've touched on some of these already, which went into our report that we continue to be working on with the system now around eConsult, particularly, and other web-based platforms, ways of using that as a resource to help people get into general practice in an appropriate way. Those improvements to booking systems and making sure that ultimately people know and understand when they're perhaps seeing a different practitioner, for example, the benefits to that and why that's the case. and that whole thing about communication, people's expectations, and services where possible, doing what they can to help people understand how to navigate the system, you know, what to expect, I suppose, from general practice, what that looks and feels like, and how to yeah, manage their expectations in line with what their service can offer. So they were the themes that kind of came out to us going back to last summer with the GP report that that we have. I'm going to hand over to Claire now, who's one of our engagement officers, to just bring you up to date a little bit more with what's happened since, and some of the things that we continue to see and hear at Healthwatch.
Hi, my name's Claire. I'm an engagement officer with Healthwatch Derbyshire, and for myself and my colleagues, access to GP services is still one of the most prominent comments and themes that we're picking up whilst we're out and about in the community. And the comments tend to concentrate on people's experience of accessing the service. People have talked a lot about online booking, and their ability to do that or their ability to not do that. Lots of people have mentioned to us as well the process of the type of appointment that they want and the 8 o'clock rush to get an appointment. Many people have said that they don't want an urgent appointment. They don't need to be triaged. They want the option to book a non-urgent appointment or an appointment to discuss blood tests or to discuss medication that they're on. And for many people, they don't feel that that's an option that they have, and they feel as if they are pushed towards that 8 o'clock to try and get an appointment with their GP. As Helen said, there's a lot around communication that we're still picking up. People are unclear about the triage process, particularly the new changes that are now coming in with regards to people obviously having that offer on the day, whether that's with the GP, a pharmacist, whether it's with a physio. People are unclear about that process. Pardon me. Lots of people also still speaking about telephone appointments. And as Helen said earlier, although people that can utilise telephone appointments find them very useful, what they would like to see is there to be some parity with a face-to-face appointment, as in when you have a face-to-face appointment, you have a set time that your appointment will take place. However, with telephone appointments, for many people, if they're lucky, they have a timescale as in between 10 and 12. Some people are being told it'll be sometime today. And for lots of people, that's simply not convenient. Although they have their mobile phone with them, it's not always convenient. They may be out and about, they may be driving, and then they miss that telephone appointment and find themselves going back through that process again. We've also heard recently of people who have given up trying to get a GP appointment, have been so frustrated with the process of ringing, being held in a queue, being held in a queue, getting through and being told that all the appointments have gone, and then they have to try again the next day. And for 2 or 3 days in a row, they've continued that process and have not been able to access an appointment. We've also heard stories as well of people completely bypassing the GP for an appointment and utilising 111 services as a way of trying to access a GP appointment. So I'm just going to show you now some of the comments that we've received recently, which kind of echo what I've just said there. So this is one comment that we received. You have to call at 8 a.m. and are told that all appointments have gone. You are told that a GP will call you back, but no time is given. You just have to wait, and you can be left waiting all day. I've been told that I can only book an appointment online. What about those of us who don't have access or don't know? How are we supposed to book appointments online? Finally, I cannot book a non-urgent appointment. Why not? I don't need to take up an emergency appointment. I just want to discuss my blood test, and I'm happy to wait. I don't want to be ringing every day. So the next steps. So the GP report has been published. It's available on our website, and you should have received a copy with your invitation to the Derbyshire Dialogue today. That full report has been sent to all GP practices, PPG networks and place leads across the county. We've also encouraged all GP practices to contact us and ask for their data set. As a result of the survey, we gathered feedback for almost all, not all, but almost all GP practices across Derbyshire. So we're encouraging GP practices to request their own personal data. And so far, 12 have requested that personal data. We've also met with the PPG, so the patient participation groups, and encouraged them to discuss the findings with their practice. And we're in contact with them at the moment to see whether that individual data is being used and whether it's having any impact on their service. And as a Health Watch, obviously, we're looking now as to what we can follow on with this report from, whether that's looking at communication, whether it's looking at digital access. But as an engagement team now, we're currently looking at the next steps. So I'll hand over now back to Lee.
Okay, thank you very much, Claire. So I'm now, thank you very much for that presentation, and I'm now going to hand over to Clive Newman, Director of GP Development, and Emma Procopio, Assistant Director of GP Commissioning and Development, for a response to the Health Watch report, and then they'll be doing a presentation on improving access to primary care.
Super. Thanks, Lee. Shall I jump in first, Clive? Shall I go for it? Yeah. So thanks, Helen and Claire. That's a really great presentation, and we did already provide some feedback to Health Watch, and just saying sort of, thank you for getting the local views of our patients. It's really helpful. We have the national patient survey, which we do get good responses to, but it's at a high level. It doesn't go into that level of detail that you've just provided, so that's really good. My initial response is that it's good to see good satisfaction levels with the care and services that patients that receive. Good to know that our practices are compassionate with the patients. That's really good, but also recognise the concerns around accessing these services. Sometimes that's the difficult bit, isn't it? It's great once you get in, but getting in can be quite challenging for some patients. So yeah, I'm not going to steal Clive's thunder with some of the detail, but a lot of the things that you talk about in there around the 8 AM rush and patients needing to know on that day how their need is going to be met has come out now through the National Access Recovery Plan for Primary Care. So Clive is just going to go into just some high-level detail on that, and then some local context around what appointments are looking like for us in Derbyshire, and then we can do some questions and answers, if that's okay. I don't know if there's anything you want to add to the Health Watch part, Clive. I think the only other thing I'd say is, with the work that we've now got to do around access to respond to the national plan, I think it'd be really good to have Health Watch in on our groups, looking at the plans that are going to come through from the primary care networks, and the engagement that's happening with the patients. So I would really like that if we could include Health Watch on that. So yeah, Clive.
Thanks, Emma, and thank you, Health Watch colleagues, and thank you everybody for inviting us and giving us the opportunity to talk. Nothing further really to add about the Health Watch report, as I share Emma's point that it's a really very good report. It was, I think, particularly helpful in your focus on eConsult, which isn't something I was very aware of in terms of the detail that you provided. So I think it does give us an avenue to explore further with practices. So yeah, as Emma said, I hope somebody can share the presentation, and it's not to me because I'm terrible with these teams. So I don't know, Mark or Lee, whether you can share our presentation, but otherwise I'll try and share it.
Yeah, that's okay.
Oh, okay. So yeah, my name's Clive Newman. I am the Director of Primary Care for the Integrated Care Board. As I'm sure you know, the Integrated Care Board is responsible for buying services for the people of Derbyshire. And mine and Emma's job is to buy GP services. As you probably know as well, GPs are independent businesses. They're not actually part of the NHS. They're separate to it, but obviously most of 95% of their work is commissioned from us in the NHS. We've got 117 GPs across Derbyshire, and they work together, but they're all separate. So there is quite a diverse picture. That being said, people are absolutely right. I'm sure we're going to talk about it a lot more, but access is a massive issue to general practice, and we can talk about the reasons for that, and I'm sure we will. But we do need to sort it out. And as Emma's already said, nationally, that this has been recognised as a big issue, and there's a new plan that's just been issued in the last couple of months, asking us to do a substantial amount of work on this nationally with some national funding, to try and remedy all of this, or at least get us into a better position. So this first slide here explains that. So back in autumn, the autumn statement committed the NHS to deliver a recovery plan, what they're calling a recovery plan. And there's two key things nationally NHS is trying to do. The first is, and it's already been mentioned, to try and sort out this issue of the 8 AM rush, where you're ringing and you can't get through, or you can get through but there's no appointments left and you're told to ring back. It's extremely frustrating. And both for practices and of course for patients, and we need to try and sort that out. The second is, and again it was referenced in the Health Watch report, that when you do get through, you need to know what's going to happen. Either are you going to get sorted there and then, or if you're not and you don't need to be, how are you scheduled in and how are you going to get treatment and support? So I think that it's helpful, the plan, and those two things are very helpful and very clearly from your Health Watch report, and I'm sure from comments we'll hear, are clearly prescient things and go to the heart of the problem. If you can just move on to the next slide. I won't talk a lot about this because I'm not trying to make excuses or be defensive, but I think it is worth noting that this isn't general practice being idle. This isn't doctors on the golf course. This is a substantial increase in demand with a fairly static, and in fact in some cases slightly reduced, workforce over a decade or more. So we have seen a substantial increase in demand since COVID. We have actually seen, we are, as you probably know, an aging population. We've seen a 30% increase in the number of people over 70 since 2010. As you get older, as we get older, I'm sure we'll all agree, you do tend to pick up problems, unfortunately, and older people have lots of long-term conditions often, and that requires more care. So we're seeing an older population which need more care, and they go to for that care to general practice, which is absolutely right, but it does mean that it puts a lot of pressure onto that general practice. Overall, general practice has responded. We are seeing them, and we can talk about this more detail. I know it doesn't feel like that, but GPs are offering more appointments than they did before the pandemic. In Derbyshire, we've seen a more than 12% shift, despite there being a relatively small increase in the number of doctors. And actually that 7% increase, that's a national figure. It includes trainees. So it's not just, it's actually probably lower than that in Derbyshire. And in fact, in some areas like practice nursing has actually dropped because, again, we haven't recruited the number of practice nurses that we need, and our practice nursing workforce, like our general population, is aging and retiring. So we are saying there is, an issue across in terms of capacity, and as we've already discussed, although satisfaction remains reasonably high for patients and people still value their GPs and the support they get from their general practice teams, people are struggling to get through nationally and locally, and there is a real bottleneck and a problem with the amount of capacity in general practice. Just to give you some sense of it, scale as well, GPs in Derbyshire there's about 600 GPs in the whole of the county. Overall, GPs and their teams offer about 600,000 appointments a month. It's by far the most appointments of any part of the NHS. So it's a relatively small number of people who are doing massive amounts of appointments. So any change or drop off in that it's it's the canary in the mine, if you like. They're the people that it's most prescient, it's most salient for them. But in terms of I'm just try and pick up the questions. Are they counting all appointments? They'll count patient-facing appointments. So they won't count. So for people, yes, it will be nurses and pharmacists and other clinicians. It won't just be GPs. So I would reframe that. I wouldn't say it blurs the picture. It offers you a fuller picture of the number of appointments offered by clinicians in general practice, because as we've said, as the Health Watch report says, in fact, not everybody who rings a general practice needs or even wants to speak to a general practitioner. We've got a massive range now of other clinicians and clinical staff who can provide a whole wealth of other support and advice. For example, if you've got a problem with your knee, 9 times out of 10, the physio is probably the best person to speak to first, rather than the GP. And if you go to the GP, they will point you to the physio. So there's benefit in these other roles. Can I just have the next slide, please? So going back to this national plan, there are 4 parts to it, and I won't go through them in detail, but you can see broadly, first element is to try and help patients help themselves. The second part, so that's called Empower Patients, and you can see the elements there, including a national aim to improve the NHS app, which some of you will have got and use, but hasn't yet been used properly, I don't think, been developed properly. So there's more work to be done to improve digital support, but also to help people to know where to go when they don't actually need to see the GP. Second is around implementing, it's called Implement New Modern General Practice Access. The first part of that is called Rollout of Digital Telephony, and that's very much about putting in proper telephone systems so that when you do call, you're put into a proper queue, you know where you are in that queue, and you can practices can kind of pull people off the queue in a more systematic way. It won't be the full answer, of course, because behind the queue, behind the telephone system, you need people, but it will hopefully make the process less chaotic in some practices. Also, to provide a standard approach once you do get through to what they call care navigation. So when you get through, where are you going to go? What's your care going to be? And the process for that needs to be more standard. And to support people who need care urgently, but also allow people who don't need that care urgently to be scheduled for a time that suits them. The third part is critical. It's about building capacity, increasing staffing, increasing the capacity to meet the demand. We have, over the last few years, expanded outwards in as much as we've seen a growth in the roles that aren't GPs, pharmacists, first contact practitioners, physiotherapists, paramedics, even mental health workers, all extremely useful and good roles. And that will continue, but we also need to expand general practitioners and increase that, and nurses, and do what we can to develop those critical roles. You'll know, I'm sure, that there's a national workforce plan that's about to be issued. We hope that that will help us to understand how we're going to increase the number of GPs in Derbyshire too. And then the final part is about making sure GPs can focus on, and practices can focus on being practices and don't get too caught up in the other work around that they have to do. So talking to the hospitals, talking to us in the ICB, and kind of bean counting. Okay, next slide, please. I won't go in a lot of detail, but this provides us with more information about what the national programme is, and we can talk about this as we go into it, what some of the detail of the work behind that we're going to be doing over the next year or so to try and deliver all of those aspects of care. And I've talked about a fair amount of that already. Okay, next slide. People will get these packs, won't they? So you'll see it for yourself. Thank you. So that's the national plan, and effectively, let me just explain what that means locally. So at the moment, we've sent out, we've asked practices through, they're organised into groups called primary care networks. So we've asked practices in Derbyshire through these primary care networks to put together a plan to set out how they're going to deliver those national aims. And in fact, we're expecting those plans back from practices by the end of this month, so the end of this week, really. Once we've got all those, we're going to spend next week and the next couple of weeks going through all of those plans and creating a Derbyshire plan, which will set out how our practices here in Derbyshire will deliver these national, will aim to deliver these national aims over the next year. So it's a good time to talk about this. We haven't got all this information yet, but we are about to start on that path. I would say, as a note of caution, that I think whilst I think the national plan is really helpful, there's a lot to do. It's hard to see the wheat for the chaff, the wood for the trees, because there's just so much in there. It's very optimistic in its aim to try and sort it all out in a year. And I think anybody who's been involved in this, and I'm sure patients, we would also be would question whether we're going to be able to get how much of this we'll be able to get done in a year. But it definitely sets us on the right path, and we'll definitely aim to do as much of it as we can, as quickly as we can. Right. I won't talk about this a lot because we have already talked about some of this, but the next few slides describe what the appointments look like in Derbyshire. And I think the take home, as I've mentioned already, is practices are working really hard. They're doing more appointments than they have ever done. They're doing more telephone, yes, but they're also doing as many face-to-face as they have done, and they have opened up these other channels as well. So they've effectively set up, there's lots of different, in many practices, lots more ways to access your GP, but as we know, there are not more GPs, and there is now a problem. We've kind of moved the problem along, haven't we? And it's now just more difficult to get through and access any of these. So if we just flick through these slides, next one, please. So as I think we've already talked about this, haven't we? This is pre and post pandemic. As you can see, we have increased overall, whilst the face-to-face has fallen slightly as a percentage. The overall number of appointments has increased, and the number of telephone appointments has substantially increased. Next slide, please. You can see what these slides effectively are showing is that in Derby and Derbyshire, we're following a national trend for face-to-face and telephone appointments. Next slide, please. And similarly, this slide compares Derbyshire and England as a whole. And again, we are, as you can see there, the number of face-to-face same day appointments in Derbyshire is slightly lower, but it's very much on the trend. And next slide, please. And this.
Do you want me to jump in on this one, Clive?
Yeah,
I'll come in on this one, just because the reason I put this in is because, just going back to what you were saying about the national plan, as part of the response that primary care networks are having to do, there's specific asks around focusing on these 5 questions that are on the patient survey. So I thought it would just be helpful to share those with the group and see where we're currently. We're waiting for last year's survey results. They should be out in July, but the previous year, where we were running against the national average. So we're not too far off on most of them, slightly above, slightly below on a couple of them. But as part, like I say, as part of the plans, the PCNs, we're expecting them to tell us how they're going to work towards the national averages if they've got some practices below them, and carry on that upward trajectory if they are above them. So we know that some of our practices don't have very good response rate to the survey. So I think for the year that this data. We had about 37,000 patient surveys sent out with a response rate of around 37%. Now, we have heard from quite a lot of our practices and PCNs that there's difficulties in getting those responses back, and there's justified reasons in some areas. So we have asked them to explore other ways of gathering this feedback from their patients, and that's why I was in the chat talking to Claire, saying if you've got your Health Watch information at a local level to individual practices, that'd be really great to feed into these plans, so those practices who do miss out on the survey results can incorporate that as part of their plan. So obviously just knowing the results alone isn't going to help the practice to get the survey results up, but a lot of the things that you've mentioned in your national expectations from the plan should help some of those. So implementing things like cloud-based telephony, so to stop patients having to hang on the phone for 40 minutes at a time, which we have heard of. So yeah, I thought it would just be helpful to put this slide in, and then I think the next few slides have broken that down to further primary care network levels. I just thought it'd be useful for the group to look at their leisure at those responses more, for their areas is what I was thinking. So I think that's what the next slide was. So I don't think there's any need to go through. Yeah, it was. So just some PCN level data on those questions. And then the final slide on this was just around the links to the publication of the appointment data. So that is available publicly at a practice level for you to drill down into, should you wish, and have a look at how your practice is doing against all of the practice in Derbyshire, regionally and nationally. So yeah, the link's at the very end of the slide deck. But I think that was it for the slides. I've tried to do a few answers to some questions in the chat. But yeah, I think back to you, Lee, I think.
Yes, okay. Thank you very much, Clive and Emma. And I do very much also appreciate answering the questions from the chat box as we've gone along. We're now at the Q&A session part of the session. So I don't know if there's any hands that people want to raise, and we can come to you and take those questions verbally. Feel free to use the chat box. There was just one, while I'm waiting for any hands to go up or any questions to be asked, that I could see from Stella on how will the ICB facilitate primary care to use PKB or MyChart used by hospitals. I'm not sure if we can answer that one.
To be honest, I can't. It's a very good question, and it's got me slightly flummoxed. So if we can, we'll have to come back, I'm afraid, Stella, on that.
I'll capture all of those that we're not able to, and make sure we make a note and come back to people on those. So in order then, I'm just going to go through the participant list, and I can see Ken Davis, you've got your hand up, Ken, if I can bring you in.
Can I put my mic on? Yes. Can you hear me? Yes.
Yes, we
Okay.
can. And just a quick note: if now the presentations are done, everyone feel free to take yourselves. You can put your cameras on, but just also be aware that the session is being recorded. So that's fully up to you. Thank you.
I did ask in chat that Clive, you raised the point that practices are being asked how they're going to implement the national plan. That really does come down to perhaps giving them guidance and models about what's available to them. Because say, for instance, a practice is on analog technology. All of a sudden, you're giving them a big job to try and shift themselves into a digital world. I mean, we've just swapped in our practice the queuing system, and it's worked well, but there was work to do in doing it. And I'm concerned the practices who may be stretched anyway are suddenly getting lumped with implement this national plan. Yeah. Without suitable guidance and models to say this is what's available to you.
It's
talk to about
beyond this. Most people's interests. And
sorry.
We're throwing more and more data at people, and it's making it look as if there's more and more excuses being made. I think
Yeah, what's bothering me, Peter, is making sure the practices have got proper support in trying to implement this national plan when they're already under operational pressure every day. Yeah, and it's important that either the PCN or ICB gives practices proper support to do those things. Doesn't just demand a bunch of answers for something they might not understand. Yeah.
Can I? Thanks, Ken. I hope you don't mind going, Ken. If I just come in, then Emma, I'm sure you've got extra to add. So I completely agree. It's almost as if I'm talking to a GP, hearing that you say that, because that is a very common. That has been a very common comment from the practices. You know, we are already really busy. We're spending, our day job is to see patients. We've got 4 more patients than we're already struggling to do that. We're not doing as well as we'd like. And now you're asking us to do this 4-part plan and do it in a year, and you know, fill it and fill in and these templates and do all of this work. So it's a big. I think you put your nail on the head. You put your nail on the head, whatever that expression is. But you're absolutely right. I think that is the issue. Just let me, if I can just explain what support we've given. So the practices are organised into these groups called networks, primary care networks, which have got a bit of management support with them. So we're working with these primary care networks, who in turn are supporting their practices. There's a whole set of guidance, webinars, plans, templates, and support. We are trying to process that all for the practice and simplify it, and then we're working with primary care networks to try and explain what we need and to help them to help the practices. But it is really complicated. It is, I've described it before as, you know, like a snake swallowing a pig. It's one of those things where we've waited for a long time to get to do this. It's great that it's come out. We're now being asked to do it really quickly, which is right because it's a real priority, but there is just a lot to cope with and a lot to do. So I think it's absolutely right. We're doing our best, and the practices are doing their best, and the networks are doing their best. But it will, I think, take a bit of time to shake out, and we'll get better with it over time. So as I said before, I don't think that we will be able to do everything that we would like to do, that the practices would like to do, that patients would like to see in the first year, because it will take time. But yeah, we've started. Emma, did you want to add to it? Because you're leading all of this, aren't you? With the practices?
Yeah, and you know, not much more to add to what you said, Clive, really, just in that we're trying to do it in a really supportive way with the practices and the primary care networks, because like you say, it is a lot of work for them to do. So wherever we can help, we've got a digital lead in the ICB who's supporting the practices who need to make some of the moves, and also as part of the primary care networks, they've recruited some digital leads as well, so extra capacity to support the practices to make these changes. So yeah, it's a lot, but we are working quite closely with the practices to make it as painless as possible for them.
That's reassuring to hear.
Yeah.
It might just be that you need to, I don't know, have some sort of risk profile flagging up where you think practices are struggling without beating them senseless.
Mm-hmm.
Yeah.
Absolutely. Yeah, that's that's definitely not our approach with our practices. We do try and really support them.
Okay. Fantastic. Thanks so much. I'm sorry to come in now. I can just see we've got a fair few more hands up and some comments in the chat box. I'm just going to try and get through as many of those as we can. I'm going to come to you, Peter, next, then Stella, then Steve. So Peter, if you'd like to ask your question, please.
Yes, if I understood it rightly, there was something like 37 patients in the patient survey, something like 37,000. And the response rate, I think you mentioned, was something like 37% from the practices, which is really not a great return. As it happens, there's been a separate survey quite recently of patient patient participation groups. This has been undertaken with a small group of PPG members in a collaborative way to establish the health of the PPG network across the 117 practices you mentioned. As it happens, the response rate from practices was 36%, which is a degree of alignment there, which suggests that maybe among quite a lot of practices, the majority, there isn't much prioritization given to this issue of patient feedback or PPG feedback. The case, I wonder whether that aspect might be something that the primary care networks might be able to be more effective in future, being more locally aligned with the practices. It may be in future more suitable or more propitious in actually getting a better return.
Yeah. Absolutely, and you know, like I said, the plans that the primary care networks are having to develop at the moment, there's 3 sections to it, and there's a whole section around ease of access, and that includes the patient survey, the friends and family tests, all local ways of engaging with their population, and we're expecting to see how they're going to improve on that. So, you know, what you've just said there about the PPG survey, that'd be really great to see as well, to support this plan with us as well. That'd be really good if we were allowed to see it, if we can share things like that.
Thank you.
Thank you, Peter. Thank you.
Brilliant. Thank you very much. Okay, I'm going to bring Stella in now, if that's okay.
Hi. Yeah, it's just further to what I was saying. I'm under 2 hospitals. I have patient knows best for one. I have my chart for the other. I don't know what the NHS app is, because my GP surgery doesn't use an app. I know some surgeries use My Doctor, so potentially I could have 3 apps for my NHS. Now that's going to be common if you've got a long-term or a chronic illness where your primary care for your treatment is going to be hospital based or secondary care based. I've not heard anything about how you're going to support your primary care with their patients who are under secondary care, and how they integrate all the care with because obviously your first port of call is your GP. But for instance, I'm a renal patient, so my primary care for my renal is my transplant hospital, but I still have my GP for anything else. But if I got diabetes, for instance, I would probably be back under the hospital because of my comorbidity. So there doesn't seem to be. I've not seen anything anywhere on how you're talking about patient empowerment, but how are you going to accomplish that? I mean, I'm a fairly expert patient, if you like. I can maintain my own care. It's been a nightmare the last 12 months because I've had to have some tests done and I've had to go to 3 hospitals. But trying to coordinate that and getting all the results back to my GP has been a nightmare. And it's been me that's had to do it. So I'm not seeing that anywhere. And I think that's something that needs to be considered. It's not going to be a general rule, but I think it should be talked about while you're talking about patient empowerment.
If I just, I think it's an excellent point, and you're absolutely right that we have individual hospitals in the past, as individual organisations will have established their own or set up their own systems, digital systems included. So your experience, I think, is not uncommon, Stella, unfortunately, where you go to one hospital, they use a particular digital system, you go to another, they use another, you go to the practice that uses a third, and they don't necessarily talk to each other, they're not integrated in any way. And that's a consequence of how digital systems have developed and how organisations have developed over many years, but it does lead you, as you've highlighted, lead to this kind of unintegrated approach, and often, as you've said, the patient themselves is left to try and organise that. Now, there is work, I think. I mean, this is not my area of expertise, but there is. We have a shared care record. We're working on that. So you have a kind of a single care record that anybody in any organisation would be able to see. We have a summary care record that's a kind of truncated version of that. But there is obviously, as you say, a lot more work to be done to try and integrate these different digital systems and bring these organisations together. We have a Derbyshire integrated care board digital strategy that is looking at that, but a lot of these are national or very localized issues, and the systems aren't necessarily set up to talk to each other, and they're run by private companies that don't necessarily aren't incentivized to work on a standard approach. So, as I say, it's out of my area of expertise. It isn't. You're right that there's not a lot of focus in this area in this particular conversation, but it is work that is happening, and it will need to continue to happen.
Yeah, somebody's pointed out Sheercade is only within Derbyshire. My hospital's a completely different region.
Absolutely, and I think
you don't talk to one another.
No, I know, and I think there's been lots of talk nationally about the need for national, a more integrated national system. But as I'm sure will be aware, it's a very complicated. It's not a monolith, the NHS. The way it's developed over the last 30 years has been separate organisations have been able to work as trusts and develop their own systems. And whilst that's brought lots of benefits, it has meant that we have got these various different systems that don't necessarily talk to each other, and we do need to do more work to try and integrate them.
Yeah, I think it's important. Thank you.
Okay, thank you very much for that question, Stella, and thank you for the answer, Clive. I'm going to come to the final hand that we got up. Steve, if I can bring you in now.
Oh yeah, thanks. A couple of things really. I've recently been in touch with Helen Henderson and Amy at Healthwatch, and thank you for your response, an email, and we will be getting back to you on that. But it's kind of linked to all this really, and two things really. To follow up firstly on what Peter said about the survey that was done with the PPG network. You should already have that data, Emma, because it was done in partnership with Joined Up Care Derbyshire. So and Hannah Morton was the lead from your side on that, and Peter and I were both on the PPG steering sort of committee for that survey. So
thanks, Steve.
So I think, but it links into my next point really about the whole issue of communication, and it just seems to be there's a joining up of dots which isn't happening. If data that's already in your own organisation, you don't know that's there, and it's just quite interesting. But we recently, as my PPG, contacted the PCN regarding communication, and the fact that there are so many changes going on within GP services. GP services being top sliced to fund work that the PCN are delivering, and in return getting things back, such as appointments, etc., other surgeries. But we contacted the PCN regarding the changes and said, right, look, we want to do something about communication. We need to get the message out to all our residents about these changes, but it would make much more sense if there was something generic, accepting there are little nuances within each G practice, but it would make much more sense if there was something broader that came out from the PCN that could be shared in some way. It doesn't have to be a piece of paper, because I appreciate that's cost to that, but some form of information that each PPG could use. The response from the PCN was basically one of not interested. They said they were happy for just to go forward and keep with what they got already, which was their patient and public stakeholder meetings, which are held quarterly. Those meetings are not representative of our area. They only cover about 50% of surgeries that go along to those meetings. So there's a whole raft of people and GP surgeries that aren't being represented, whether it's because those surgeries don't have PPGs or not. But it just seems that, say, rather than and basically the response from the PCN was to bat it back to the GP surgery to sort out in terms of getting the message out. And that just seems to be a real poor show. And based on the things that have been said at this meeting today by the people who are sitting in powers and have the positions, Helen, as I've already spoken to, the things that Clive and yourself have talked about, a lot of it comes down to communication. And when the PCN are turning around and batting it back to us and saying, get on with it yourself, poor show, really is. And it doesn't join up the dots at all. And I'm sorry, it makes joined up Care Derbyshire does not look very joined up at all. And so we now have to follow back to Helen at Healthwatch to see how we can tackle this issue, because yeah, it just seems poor. Thank you. It's probably more of a comment and a question that you can answer. I appreciate that, but it's just, you know, if that what's happening in other PCNs, you know, is it the same there as well? You know, I'm in Erewash, and where say you've only got 50% of or less at each of those. I go to those quarterly meetings, and there are only normally 5, 6 at most doctors at GP surgeries that are represented. So there's an awful lot of people who aren't. So that communication needs to go out, but they don't seem interested. And I think that's poor. And maybe I shouldn't be saying it here, but somebody's got to hear it.
Okay, so, thank you. And communication coming through as a key theme again. So we'll take that on board and feed it in. I know you referenced my colleague Hannah, and I'll check on that report that you mentioned. I'm just going to try and squeeze one more in, bearing in mind we've got 3 minutes left. Stephen Bramley, if I can just take that question ever so quickly.
Rather than a question, it's sort of in support of the previous comment. As some of you will know, I'm a member of the Public Participation Committee for the ICB. And a number of times we have raised the point that there is little or no public representation on the PCNs. We're hit to stone with it all the time. PPGs, nightmare. Personally, my practice, the PPG fell apart in 2016. I've been trying to get it reinstated ever since. And there have been moves in the last 4 months or so to try and get at least a virtual PPG re-established. And that had one meeting and it's again fallen flat on its face. So to get the public's view on matters, you really do need to have that communication with the public. One of the best ways is for all practices to have PPGs that are effective and working so that it can be fed back through the PPGs to the patients. There just seems to be a lack of continuity in general to me, and this is my personal view, not a view from the committee, of the way we integrate patient participation through the system. That there are certain practices that have got really good PPGs. There are all the different committees throughout the ICB that some have got very good representation. We've got a really good group of people that work as engagement officers, and Lee's one of those. And there's an awful lot of really good work done in engagement. But having said that, there's still a lot of shortfalls, and until those things are dovetailed in to make the whole picture work better, we're going to have these challenges. One comment I did put on the chart was with regard to System 1. Why on earth don't we turn the non-urgent appointment booking online back on at practices? Because that would take away, I appreciate not everybody can access it and not everybody's got internet, but the ones who can would no longer need to be in the 8 o'clock phone rush. So that's an instant win. But I've asked that question time and time again and get no answer, never mind a logical or reasonable answer. Anyway, that's my soapbox over. But I think overall, I understand the difficulties of the whole system. I've been heavily involved with a lot of things. I'm involved with the information governance, so I know about the Derbyshire Shared Care Record. That's why I put the comment in that I did. It only works within Derbyshire. The challenge there is if you're under Hallamshire or you're under another hospital somewhere else, it's not shared. So it's I think we've done really well. There's a lot of really good work being done, but I do think there's a few things that really need working on urgently, and certainly PPGs and getting lay representation into the PCNs are critical. Thank you.
Okay.
Thanks, Stephen. Lee, do you mind if I just come in on
sorry,
that? So thank you, Stephen. That's really helpful feedback to have, and I think I don't think we shared the national documents that Clive was referring to and some of the content in there. So there's quite a bit about communicating with the public in there. So I'll share those with you, Lee, after this, so that people can see the expectations around practices and PCNs with communicating. But you've just there's a session happening right now with our PCN managers, and you've just given me a prompt to ask them to put in their plans about which of their practices have got PPGs. So thank you for that. You've just given me a prompt. So yeah, it's not as good as it should have been, but hopefully, you know, moving forward now with this plan and this support, we can make improvements on that and see some change. So thank you.
Okay, brilliant. Thank you very much. Thank you, Clive. Thank you, Emma. Thank you, everybody that's come along today, especially those that have asked questions, input to the session, and to Claire and Helen for presenting the Health Watch report. I appreciate we've run a couple of minutes over, so I'm going to bring the meeting to a close, but we will circulate some comms after this. I can just see Mark's actually popped the link to the Derbyshire Dialogue session in there, where we'll comb through today's session as well and put any helpful responses and useful information off the back of that onto there. Thank you very much for attending today. Thanks once again to all of the presenters, and hopefully we'll see you at the next Derbyshire Dialogue. Thank you.
Thanks, everybody.
Thank you.